This is the cervical HVLA treatment video with translation emphasis. So for this technique, I'm actually going to diagnose with translation. So I bring my hands out onto the transverse process of the cervical spine, and I translate back and forth until I find a segment that's restricted. Usually this is easier to do in the lower segments, and I've got a C6 that refuses to translate to the right, which means that it is rotated and side bent to the right. So for that treatment, I'm going to take my second MCP and I'm going to put it on the lateral edge of that articular pillar. Not as far back as I would for the rotational component. I'm on the lateral edge of that articular pillar. Again, I need my anterior translation. This time I'm going to rotate into the ease, to the right in this case, and then I'm going to translate into the barrier. So I get my anterior translation and my rightward translation all the way into the barrier. Again, sometimes it's easier to stand up. You'll get a little bit more leverage. And then once you're all the way in the barrier, the corrective force is just a short translatory force rightward and a little bit anterior and inferior towards the shoulder, just like so. And then always reassess.